curious about how, when they are short, how can we be a little bit taller. There are two kinds of process. It's a surgery, it's a serious surgery. In one type of this lengthening surgery, they call this intramedullary. In intramedullary surgery, they put the machine in your bone to make it taller. So there are another one, they put the machine outside, not in the bone, not inside your skin, totally outside, and they just fix this to your bone from outside. There are advantages, there are disadvantages in both ones. For instance, if you put inside, you don't see. Cosmetically, it's okay, intramedullary type. But you cannot step on it. You cannot walk. If you want to do this process to your both legs, then it's not recommended. Also, if your bone is a little bit tiny, then you cannot put this machine also in the bone.
For how long you cannot step on the feet?
Till the process complete, till the rehabilitation complete, then you shouldn't. I mean, when the process is done, then you can do the other one. The process for 1 day make the machine taller for 1 millimeter. So for 10 days, you gain 1 centimeter. This is the average one. So this bone producing speed is also showing us that how many centimeters we can gain in how many days. Another thing, when do we need this surgery? Who needs this surgery? So there are two kinds of reasons. Some medical reasons that we need this surgery, or cosmetic reasons that we need this surgery. Medical reasons, you know, the sickness of dwarf. The dwarf limit is like 140 cm. If you are less than 140 cm, that means you are dwarf. So medical reason is that one. Then we recommend to do this surgery. Cosmetic reason, if you want to be a little bit taller, yeah, then you can have this surgery. In this process, how many centimeters can we gain for our body? So for dwarf people, the limit when we come to 150 for the women, and for the boys when we come to 160, then we stop the process. Then the treatment is done. And for cosmetic ones, it depends on your wishes actually. The medical doctor and you decide together how much centimeter you want to gain, and you can have this surgery then. In this one, of course, the patient's expectations are important. Like if your body is short and you want to have tall legs, then it will not be a harmony, then we cannot do. So all those things come together, and then for cosmetic reasons, they decide for it. So it's a hard process. So what are the risks actually for this surgery? There are some risks on extramedullary one because there are ropes outside, the metals is going in your body. The bigger risk is the infection, and the rehabilitation period is important because when you are making taller, lengthening to the bone, then your muscles are getting tighter also. So it's getting a stress on the muscle. So you have to make stretchings, exercise you can do at home, but it's more recommended to do with specialists.